Good morning, everyone, and I hope that you all are doing fine. We are meeting after so many days now, and okay, so we will start with this topic here, local anesthetic. I'll just tell you a funny thing about this. Few days back, I thought that I need to record the further topic. So, I covered all this topic, and at the end of the recording, when I just want to press stop recording, when I just went there, and I was like, I was not at all recording it. I covered everything, but it was not recorded. So I was like, oh shit. But yeah, that's okay. So we will start again with this topic, which is the local anesthetic. And I will try my level best to, cover at least TG as soon as possible. But it's just the time constraint with everything which is going on. Okay, so let's start. So local anesthetics are commonly, that LA is very commonly used in dentistry. Out of 10, most of the patient, like 8 or out of 10, would require LA because it is a strategy of pain control, and it also has very low incidence of adverse effects. But before administering LA, you must know the local and the systemic complications that can arise, that we will read in further pages. Okay, so what are the common methods of administration? It could be infiltration or the block. So for the infiltration, it is mainly that we inject the LA adjacent to the tooth that we require to get numb. Okay, and infiltration is generally for the maxilla. And even you can also try in mandible anteriors, but block is mainly for the mandibular molars. Okay, then there are other methods like the topical gel that we apply that is used for minor painful procedures, such as if you want to remove the band or crown placement or mucosal incision, because the topical administration only would numb the top mucosa, so we can use it for those purposes. And it may also be used because in some anxiety prone patient we first put a gel on that area so that the mucosa would go numb, and well, although they would feel the prick of the needle, but it would be a bit lesser, so we can try as a strategy in the more anxious or needle phobic patients. So if you give the analgesia in infiltration, it would take around 2 to 3 minutes to kick in. And for the block, it is 4 to 5 minutes. And for the topical also, it is 3 minutes. Okay. The duration of effects would depend on which LA you are using. For example, if you are using lignocaine, it would wear off sooner as compared to articaine or the longer acting LAs. Okay, and how much dose you are giving the patient and which method you are using, because if you will give the block, it would take a longer time, right? Then you need to advise the patient of the likely effect, like you will be numb for 2 hours or more than 2 hours, and do not take anything hot, and be careful while eating because your lip is numb or you are numb. Okay, so you need to tell them the required duration, like 2 hours or 2 to 4 hours, and even after that, if you still feel numb, you can come again and we can check what is going on, because in certain, with the respect to certain LA, there is a chance of permanent anesthesia or the other paresthesia, so we need to make the patient aware about that. Okay, so medical practitioners, so if the patient went to the GP and they are in very severe dental pain, for example in irreversible pulpitis, because LA is also a strategy of pain management, they can also try it, but make sure that they are very confident in that technique. Then some local anesthetics are available in single use dental cartridge, which may be easier to use. So every LA, we generally use the vasoconstrictor in it to increase the to increase the duration of the effect of LA and to stop the anesthetic loss in the circulation and also to reduce bleeding. So every LA generally we have adrenaline. So if in some patient adrenaline is contraindicated because adrenaline contain a substitute which is the sulfide. So if the patients are allergic to sulfides, then we cannot give them adrenaline. Then we need to choose another LA with felipressin as a vasoconstrictor in that. Okay, but yeah, although it was previously said that we cannot give felipressin in pregnant women, but now it is safe to be given. Then are the adverse effects of LA. So there are two complications, the local one and the systemic one. The incidence of adverse effect is low and it also differs between individual local anesthetics. Okay, but you need to know, you should be familiar with the diagnosis and how to manage it. You should have resuscitation drugs, equipment, including oxygen, should be available for immediate management of systemic toxicity. If adverse effects occur or are suspected, then you need to stop the LA and provide appropriate management. We will read it in medical emergency topic. Okay, and then problems with the injection technique could be because we generally go according to the landmarks, but in some individual the landmarks can be a bit different, so that can lead to problems with the LA technique. So what can occur? Either there would be complete or partial failure, or you have injected the LA in your exact direction, but still the patient is not numb. So that could happen because of the anatomical variations. Okay, so if this occur, you need to review the patient's anatomy and review your injection technique as well. You can try repeat injection, but you should know what is the maximum dose is not exceeded. Okay, and there could be some chances that you can traumatize the adjacent nerves and the surrounding tissues which are present, so that could lead to hematoma, right? And the profound systemic effect. So, if you have injected the LA solution into a blood vessel, then it can go systemically and it could lead to systemic complications, which would be to mitigate the risk of intravascular injection. What you need to do is you always need to make sure that you are aspirating before injecting to exclude the presence of blood, to exclude that you are not injecting in the blood vessel, and then you need to inject very slowly and also monitor the patient's response. How is patient responding to it? Okay, then are the local complications. So, local neurological complications, trauma to the tissue, and rarely local complication can arise from equipment failure. It is very rare that the cartridge can explode. Okay, so the local neurological complication might be like you have given the LA and the patient is very numb since like a long period, like paresthesia or dysesthesia, or sometimes the temporary, if you have injected into the facial nerve, their facial nerve can go paralyzed for temporary period of time and prolonged anesthesia. Okay, so in most cases of prolonged anesthesia, they would resolve on their own. Permanent anesthesia is very rare. Nerve injuries are rare and can be caused either by the direct nerve trauma or by the indirect. How can indirect nerve trauma happen? If you have injected into the nerve sheath, the bleeding from the nerve sheath can irritate the nerve. Or localized neurotoxicity. You have injected so much amount of LA in that area, so that could also cause the nerve injury. The risk of nerve damage is increased with repeat injection into a partially anesthetized site, or administration of higher concentration. For example, if you are injecting artricin, so it has 6 times more risk of uh, permanent anesthesia as compared to lignocaine. Then trauma. So trauma would be hematoma. So if you during injecting you have caused any trauma like or accidental intramuscular injection, because there are muscles of mastications which are lying there. Okay, so if you have accidentally injected in one of them or adjacent to that, then that could lead to trismus, and either as a direct effect of the drug or due to the bleeding within the muscle. If trismus occur, you need to promptly seek advice, because for the trismus, the sooner we act on it, the better would be the outcome. So you need to refer the patient as soon as possible to the oral medicine or the oral surgical specialist, because early management can improve the outcomes. Then are some of the systemic toxicity which would occur if you have injected the LA into the vessel, blood vessel, okay? Or if you have given excessive dose, or the inpatient, the drug clearance is impaired, or there is rapid systemic absorption. Okay, so they are usually seen in a continuum as plasma concentration increases. So the use of lowest effective dose should be there. Okay, and do not exceed the maximum. We would calculate what is the maximum recommended dose of LA that you can inject. What could be the systemic effect? There would be some effects on their brain, on their heart. Okay, so CNS, CVS, respiratory, allergic, and rarely methemoglobinemia. So these are some of the effects that can occur when you inject the LA into the blood vessel. So always make sure before injecting that the patient is not allergic. And the methemoglobinemia, it is very serious complication. It can turn the patient into slate gray skin discoloration and cause cyanosis. And it generally occurs with the LA, which are prilocaine and benzocaine. Okay, but still you need to make sure, and if that occur, because it is a life-threatening situation, you need to refer patient immediately to the hospital. Okay, then if the systemic toxicity occur, you need to stop the administration and provide appropriate management. Then types of LA available. So short to immediate acting. So if you are using the plain LA without any vasoconstrictor, it would be shorter acting. But if you would add the vasoconstrictor, it would become immediate acting. So lidocaine plus adrenaline, it is the first line routine, because for every patient we generally use this one. But if there is any contraindication, for example, patient is allergic to adrenaline, then we need to use prilocaine with felipressine. Or we can use mepivacaine with adrenaline. But it has you should not use it in children younger than 3 years. And articaine with adrenaline, it has a higher risk of prolonged or permanent anesthesia, so never use it for blocks, only for infiltration. And do not use it for children younger than 4 years. So it is children younger than 3 years, 4 years, and these are some of the very long acting preparation. These we do not really use it, but still you need to know which are the ropivacaine and bupivacaine. So for these are generally required if the prolonged analgesia is required, and or for the post-operative pain and refractory acute dental pain. Okay, and the concentration up to 0.5% can be used in children. And similar indication for the bupivacaine is just more cardiotoxic than ropivacaine, and cardiac toxicity may manifest before neurological toxicity. And for the bupivacaine, do not use in children younger than 12 years. Then how you need to calculate the doses of LA in dentistry. So the dose required to prevent the patient from experiencing dental pain is usually much lower than the maximum dose, provided the method of administration is appropriate. The LA is injected into the, if you will use the correct LA and injecting it into the correct site, then the you would get patient out of pain very quickly. And how can this happen? Like, what are the variable factor? Area to be anesthetized, the vascularity of the eight tissues, whether you are giving infiltration or the regional block, what is the age of the patient, physical condition of the patient. Okay, and overdose can very easily occur in children and particularly the young children. And for the elderly, because of the age related changes of their bones, because their bones have become very thick, we may require a lower dose. Okay, and multiple repeated doses within a short period of time can result in accumulation of LA, and it could lead to systemic toxicity. So you need to make sure what you are doing. But in case of incomplete or failure LA injection, a repeat dose may be tried provided the total dose administered to the patient does not exceed the maximum single dose. So what would be the maximum single dose for a patient? So if the patient is 70 kg patient, so lidocaine 2% means 20 milligram per ml with adrenaline. Adrenaline is 1 ratio 80,000. It is present in the cartridge in this ratio. Okay, so calculate the maximum single dose. What you need to do is for the adrenaline, for the lidocaine with adrenaline, the single maximum dose is 7 milligram per kg. So if you need to calculate for the 70 kg adult, you need to multiply it with the 70. So it would come as 490 milligram you can inject in 70 kg patient. But if you need to convert it into mg per ml, then you need to divide it with the 20, which is the 24.5 ml, because generally the LA cartridge, which is that is in liquid, right? So this dose we can convert it into the liquid, so you can inject 24.5 ml of the LA solution. So how many cartridges does contain 24.5 ml? So you need to divide it by 2.2 ml per cartridge, because if your cartridge contain 2.2 ml solution, so it would come around 11 cartridges. So same as for prilocaine. So for the lidocaine, the maximum safe dose is 7 mg. So for prilocaine, it's 9 mg. So you can do your calculation. First, you need to convert it by multiplying it with the patient weight, which is the 9 into 70. You will get the patient's weight, whatever the weight is. Then you need to divide it by the volume, which is the what is the present in the patient's what is present in the cartridge. Okay, which is the 30 mg per ml for the prilocaine. For the lidocaine, it was 20. So you need to divide it with the 30, and then you can convert it into the how many cartridges. Like for example, 2.2. Then you can divide it again with the 2.2, and you will get the number of cartridges that you would require to be sufficient for the maximum dose. Okay, so and there is one more thing here, which is sometimes we give the patient mixed LA. Like for example, first we have given them lidocaine, and then the patient is not really numb, so we need to repeat the injection, and we are using some other type of LA. So always inject the maximum safe dose, which is the lower in number. Like for example, so here they have given the example. So for example, the maximum volumes of safe single doses are 24.5 ml for lidocaine, and for the ropivacaine it's 28 ml. So always inject the lowest of these two, which is the 24 ml only. Okay, so the combined volume of lidocaine and ropivacaine must not exceed 24.5 ml. Okay, so this is what the local anesthetic topic was, and hopefully in as soon as I get some more time, we will cover this anxiolysis topic. Thank you so much, guys, for watching my videos, and yeah, good luck with your preparation. Thank you.